extension of our 8 laws of health in the Adventist Church. Was everybody here this morning? Anybody not here? I'm an emergency trained physician and also board certified lifestyle medicine. I'm going to give a quick overview about lifestyle medicine, and it's actually there's a website you can go to called PubMed, and you can put in any disease or anything you want, medication, and it will tell you, it will give you all of the research articles in every research journal there is. If you punch in lifestyle medicine, you'll get over 72,000 hits. Lifestyle medicine is probably the fastest growing field of medicine, and the volume of research is unbelievable. This is just I just pulled up one. This is actually from 2023, Lifestyle Medicine Prevention, Treatment, and Reversal of Disease using lifestyle medicine. And lifestyle medicine has, like I talked this morning, there's 6 pillars, and these are they're very simple, they're very powerful, and they actually work. And it's nutrition, which is basically recommend a predominantly whole food plant-based diet, and the research, again, there's tons of research to show that this is really the healthiest eating way to eat. Good restorative sleep. We should be getting 7 to 9 hours of sleep a day. And sometimes you say, well, I wake up during the night. Well, the way our sleep cycle is, actually everybody does wake up, and then you go back, you may not realize that you woke up. As we get older, especially men, we get up a couple times a night for other reasons. And physical activity, I'll talk, physical activity is so important for our cardiorespiratory systems, for our immune system, helps us sleep. It's actually one of the best antidepressants there is. Actually, physical activity has been researched better than some of these antidepressants we have. We used to have some really good antidepressants. One was called the tricyclic antidepressants. Really good, but they were also great suicides. So as an emergency physician, we go, oh, we got a tricyclic overdose. Oh, those are fun to take care of because they go through every kind of cardiac arrhythm. And we'd have to do all kinds of procedures on them. That's why I have a really nice car out there. No. That as an emergency physician, you don't want to see people sick, but when they are, you want to be able to take care of them. And then, stress and good social relations and avoidance of risky substances like tobacco, alcohol, and drugs. Interesting, I did mention this morning, we've all heard that moderate alcohol is good for the heart, right? The research now, they're going back, well, actually it's not. Because the way the research was flawed. They were just asking people, do you drink? No, didn't ask what their drinking history was. And so that's why people that didn't drink had a little bit higher disease and fatality than the people that did drink maybe a couple drinks a day, and then it would go up. It's more linear. Even our medical societies are starting to say, yeah, none of it's good for you. And then Britain, I think, has even came out and said, no alcohol is good, not even for your heart. Why do people, but everybody, is a little wine going to hurt you? Well, it could. But it's just showing what we've been saying for years. So, the American College of Lifestyle Medicine, it began in 2004 at Loma Linda University. A small group of physicians, about 15, started this program because they knew how powerful lifestyle was. Now there's over 14,500 members in the American College of Lifestyle Medicine, and only a small minority are actually Adventists. Again, it's growing fast. It's on all 7 continents. There's an international global alliance of lifestyle medicine. In 2017, they actually had their inaugural board examination. That was I took that board exam in 2017. There was about 150 of us in there. And actually in Colorado, there was only 3 people that took it. It was myself, a cardiologist on the Western Slope, and a family practice doctor up in Aspen. Now there's over 8,000 board certified physicians, and next month they'll have their next board exam. And then it's one of the most researched, it's in all the peer review journals, and these are just some of the journals that are involved. Well, lifestyle medicine is actually considered the first line of defense. Every medical specialty has a set of guidelines for, if you're internal medicine, you got your guidelines for diabetes, cardiology has their guidelines for cholesterol and heart attacks and all the things. And all of them are talking about lifestyle medicine is the first line. This is an old excuse me, this is an old study, or not old study, this is an old copy of their the guidelines for from the American Heart Association and American College of Cardiology for basically lowering cholesterol to prevent atherosclerotic heart disease, ASCVD. Right in the guide sign, it says, lifestyle, lifestyle is the foundation. So the first thing they say is, do lifestyle. Now you go to your doctor, you go to your cardiologist, and you say, well, your cholesterol is 250. You know what you need to do? You need to start eating healthier, exercise more, and take this cholesterol-lowering drug. And I'm not against medications. Despite what some people say, doctors don't make money by writing prescriptions. We don't get kickbacks. And almost every doctor I know wants to see their patients get better. They don't care how they get better. But we're scientists, and we like to, we can give a drug and we can see a reaction. Great. But I got more satisfaction when we taught our CHIP program to see the good, and I'll talk about that a little bit, about the good results than I did after a busy night in the ER where I may have saved a couple lives. Well, chronic disease is an epidemic. We have, we have heart disease, we have diabetes, stroke, Alzheimer's, and 6 out of 10 people have at least one chronic disease. 4 out of 10 have 2 or more. About 38% of every American will be diagnosed, 38% of Americans will be diagnosed at some point with cancer in their lifetime. And about half of all Americans have some sort of cardiovascular disease. It says 88 million, but actually this is an older slide. 98 million people have pre-diabetes, and I think 38 million have diabetes. I can't really read this. I do want to talk about vegan versus a healthy plant-based diet. It's easy to say when I go to a restaurant, yeah, I want this vegan, although I don't consider myself a vegan. A true vegan would not call me a vegan, even though I don't eat any animal products. Veganism is more of a religion. People that do it they're concerned about the welfare of the planet or the welfare of the animals. I have seen a few 300-pound vegans in the ER, and it was not all muscle mass. Vegan pastries, vegan donuts, sodas, that's all vegan. It's not healthy. Well, is a vegan donut any healthier than a non-vegan donut? Probably not. There's no cholesterol in it. Would I ever eat a vegan donut? Sure, they're good. I'll have one every now and then. I enjoy life, despite what I say sometimes. So. But these are not, but here's what a healthy plant-based diet, and what we had for lunch today was, everything was great. It was healthy, and, legumes, fruits, vegetables, whole grains, some nuts and seeds, water. These are healthy eating. You know why vegans don't eat honey? It's not a joke, actually, because they're stealing the honey away from the bees, and some bees are killed in the harvesting of the honey. Well, you go harvest some corn, you're going to kill some bugs in the ground too. So, anyways, obesity has become an epidemic. I mean, when we were kids, to see a fat kid was unusual. We had one kid in high school. He was a roly-poly. Turned out he had a thyroid problem. We got on thyroid medicine, and he lost a lot of weight. But the U.S. did every year looks at the prevalence of obesity in the United States, and what they use is a BMI, body mass index. Oh, thank you so much. And so the way they do that, they take your height in meters and divide, or your weight in kilograms divided by your height squared in meters. And they did have some exclusions for it. If you weighed less than 50 pounds or weighed over 650 pounds, you were excluded. If you're shorter than 3 feet, or if you're 8 feet tall or taller, you were excluded. If you're pregnant, you were excluded from the prevalence. But a lot of people don't like the BMI because they say it's not real accurate. It's pretty good, but if somebody who's like, say, a weightlifter, weighs 220 pounds, he's 5'10", and he just got so much muscle mass, they're going to have a high BMI, even though they're not fat. So it's not perfect, but it's not bad either. So this is, I think, in 2011. You can see green is, I think, 20 to less than 25%. The orange is 25 to less than 30%, or yellow is 25 to less than 30%. And then orange is 30 to less than 35%. And then as you start seeing reds, they go up. And this is 2012, 2013, you can see our first red, and more, and 2016, 2017, 2018. Notice Colorado, and actually can't tell, but over on the right there, DC, are the only ones that are 20 to 24.9%. And then it starts to get at 2020, 2021, we went up a little bit. Of course, this is COVID, and you could see how bad it really got. And a couple of are over 40%. And then we went back down in 2023, and so we're healthy again. It's funny because I was working one night, and we had a new nurse, and she came from Oklahoma, and she goes, "I just love it here. Everybody is so thin, When I was in Amarillo, it was the same thing. We had a restaurant down there called the Texan, the Big Texan, yeah. And if they had a 72-ounce steak, that if you could eat the steak and all the trimmings, include the shrimp cocktail and the salad, if you can eat it all in an hour, you get it for free. And periodically, I'd see a worker there in the ER, come in to cut themselves. And I'd go, "Anybody ever do it?" And they said, "Yeah, but you'd be surprised. It's usually these skinny guys that do it, not these big, heavy truckers or something." But, yeah, but people don't think about what they're doing to their health later on. I need to get my computer out just because those are so small I can't read. My eyes are getting older, I guess. But I heard you guys are getting an In-N-Out here yeah, we got a few in Colorado Springs, and I used to love that place. Let's see, where are we at? Sorry. Almost there. It's just a summary. Yeah, that, again, Arkansas, Mississippi, and West Virginia had obesity rates of over 40%. And so I like what Hippocrates said, let food be thy medicine. Now, this is interesting. Diet is actually the leading cause of chronic disease and disability. I think tobacco is like, what, number 4 down there. Of course, people don't smoke as much either. And this is not just in the United States. This is actually an epidemic worldwide. NPR did a poll a number of years ago, 3,000 people, and one thing they asked was, how they would rate their diet, their eating habits. Was it healthy? And 75% of them said, yes, it is. I eat very healthy. Yet the fact is more than 80% of Americans eat less than the recommended amount of fruits and vegetables. And then less than 3% of Americans live actually a healthy lifestyle. This is from the Mayo Clinic. They looked at 4 identifiers. One was exercise. They do the right amount of exercise that's recommended by the guidelines for Americans of 75 minutes of vigorous or 150 minutes a week of moderate exercise, a diet score in the top 40% of the healthy eating index. And that's a healthy eating index. It scores foods by the higher the number they are, the healthier it is. I wouldn't score perfect because they do have fish in there, they do have dairy in there, but that's how they get that. Then a body fat percentage, not a BMI, but the body fat percentage, less than 20% for men, less than 30% for women, and not smoking. It's on the left is pills and surgery, on the right is lifestyle change. It's, hey, it's not funny. I had a patient one night, young man, 28 years old, comes in the emergency department. I diagnosed him with new onset diabetes. And he goes, and so I start him on metformin medication, but I told him, I said, listen, you don't have to do this. There's a way that you can actually beat this. I started talking about diet and exercise, but I only took about 5 minutes of a busy ER. And he just looked at me and said, I'd rather take the pill. Well, it's only you're going to have to take more pills and you're going to take shots, but, wasn't much, about a month later, it was a really busy night, and about 10 o'clock at night, and this gentleman comes in, he's about 35 years old, nice family, his wife was probably 280, they had 2 beautiful kids, like 7 and 9, and he comes in with a fever and a lot of pain in his rear end area. And I basically diagnosed him with an abscess in his rectum, which is required to go to surgery. But his blood work comes back and his blood sugar is over 500. And I told him, and he goes, sir, you have diabetes. He goes, I was afraid of that. He goes, my mother had diabetes. She wound up having a heart attack. She actually had a leg amputation. So he knew all the complications. So I go, I'm not going to do the 5-minute quick talk. And nurses were getting upset with me because I sat down there for over 20 minutes talking to him and his wife about dietary changes and actually what they can do to to not only, arrest this, but reverse it, put them in remission from diabetes. And, nurses are giving me a look, come on, we got patients, I go, keep doing CPR, I'll be there. And he said, no. A cardiac arrest, I would have left. But I'm thinking, I'm getting through to these people. They're looking excited. And then, I'm going back between the husband and the wife. I go, I might save a family. Then I look at him. He goes, but I love my meat. And when he said that, I looked at her, and she'd looked startled like he just stabbed her in the heart. He's telling you, you can beat this. And I told him you'd also lose a lot of weight too. But but you never know what I told him, how much, because he went off to surgery and got admitted. So. Well, these are the U.S. dietary guidelines for food. You hear, and first of all, I am not going to be political at all, but I am going to call out things that are wrong. RFK Jr. is talking about the food pyramid and the food pyramid. We haven't had the food pyramid since 2011. And he's talking about nobody's healthy. Our guidelines need to be changed because nobody's healthy. Well, nobody's healthy because nobody's following the guidelines. And then he talks about, there's too much big business involved in the guidelines. And to a certain extent, he's right. The meat and dairy and egg industry are all involved in helping going with the guidelines. Well, the U.S. dietary guidelines are actually pretty good. Half the plate should be fruits and vegetables. A quarter of the plate should be whole grains, and a quarter of the plate protein. And then they have dairy as their beverage. Canada has the exact same guidelines, except for their beverage is water, because they don't have any industry involvement. And what's interesting, Canada also says, try to get more of your protein from plant sources than animal sources. Like I said earlier, the biggest obstacle to eating healthy is going to be your friends and family. Did I turn that? Oh, there we go. So, yeah, I like that. People eat junk food without batting an eye, but offer them something healthy and they become researchers. Tell anybody that you're eating vegan, they'll tell you why you're unhealthy. They ask me, where do you get your protein? I go, do I really look protein deficient? Or they'll say, well, you're taking something, aren't you? I go, no. I'm going to talk a little bit about diabetes. And this is from the American Diabetes Association. In the past, anyways, they said, reversing diabetes, the historical paradigm, medical paradigm, there is no cure for diabetes. The National Library of Medicine, guideline, diabetes, lifelong disease, there is no cure. Mayo Clinic, there's no cure for type 2 diabetes. I'm going to cut to the end. What the Diabetics Association says now is you can't cure it, but you can put it in remission, and I would agree with that, because you change your lifestyle the other way again, and your diabetes will come back. We look at 5 stages of diabetes or of high blood sugar. There's 6 up there, but the first one is normal, but it's or optimal sugar. Your fasting blood sugar should be 70 to 84, at an hour, 80 to 119, and then at 2 hours, 80 to 99. This is with the glucose tolerance test. What they do is they take they get a fasting blood sugar on you, then they give you a sugary drink, usually 75 to 100 grams of sugar, and then they recheck you. They'll often do it every 15 to 30 minutes, but at the end of 2 hours. And they rate it as high blood sugar, higher blood sugar, pre-diabetes, advanced prediabetes, and then diabetes. Diabetes, your fasting blood sugar will be 126, and in 2 hours, it'll be 200 or more. That's how we make the diagnosis. Now, there are actually 3 types of diabetes. The first one is type 1 diabetes. That's only 10% of the population. That's an autoimmune disease. What happens is there's multiple antibodies to either the beta cells, which are the cells that produce insulin in the pancreas, or the insulin. And it comes on relatively quickly. 6 to 12 months is a kind of a honeymoon period when the sugars start going up to time you need insulin. And usually the insulin is going to be pretty high. You cannot use oral medications for type 1 diabetes. And it usually affects those under 30. We used to call that juvenile diabetes. And it could be fatal. There's a condition called ketoacidosis that people will get into that I hate to say this, it's a fun thing to resuscitate when somebody comes in like that, because you can actually get them better. That's the fun part, seeing someone get better. I had a kid one time, about 9, 10 years old, busy morning. I was working a day shift, busy morning, and the waiting room was packed. The mom checks her son in, and they said, we'll just take him right back to the ER. And she said, why'd they bring him back so quickly? You know, this kid looked like he was on death's door, but it progressed over weeks to months to the point that the mother didn't realize how sick he looked. She knew he needed to bring him in. And he was in diabetic ketoacidosis. His blood sugar was over 900. And, you know, he looked, I mean, he was one I was afraid could possibly die. Fortunately, he didn't. He did well. And so it is a terrible diagnosis. But fortunately, it's only 10% of the population. There's what we call latent autoimmune diabetes, too, or type 1.5. These are people over 30. And instead of multiple antibodies, there's only a single antibody against the beta cell or the insulin. So it takes longer for it to actually get to the point that you're really sick. And we say there's like a 3 to 5 year honeymoon period. And your insulin requirements go up more gradual. And then there's type 2 diabetes. This is the most common, 90%. We actually used to call that adult onset diabetes. Now we're seeing children with it, with this obesity epidemic, and we'll talk a little bit about it. But we have 3, you know, it's multifactorial, and they do overlap. You know, lifestyle is number 1. Diet, exercise, stress, just bad habits. Environment, including your internal environment with your gut bacteria, medications that you could be on could cause it. Food deserts. You've heard of that. That's where people live, especially in urban areas where they don't have access to good quality food. And then epigenetics. You know, every cell in your body has every gene needed. But this is not a heart. This is not an ear. I mean, an eye. You know, so certain genes have to be turned on and turned off, and this has to do with the epigenetics. And so certain things, and especially be related to lifestyle or the environment, can turn genes on. I was never diabetic, although there's no diabetes history. There's a lot of genetic, a lot of people with bad genes or genes for diabetes. And so I've seen people, though, that I want to get this out real quick. It's a documentary. It was made by Advent Health in Florida called Plant Wise. I don't know if you've ever seen it. Yeah. I would recommend showing it in the church. Excellent. It's an excellent documentary. I think it's only about 45 minutes long, and we've shown it, and I've shown it to non-Adventists. It's very powerful, and just show one guy with diabetes, type 2 diabetes, family history. His brothers had a heart attack and amputations, and he was on his way, and he reversed it completely. And plant-wise, it's free. You can download it, and so like I said, it's the old name was adult onset diabetes. Again, the most common form. And same complication type 1 as type 2. Neuropathy, where you lose feeling in your especially in the legs. You get amputations, have heart attacks, strokes. You go into kidney failure. Many people on dialysis are diabetics. Can cause you to go blind. There was a guy I met one time. You ever hear of John McDougall? He's kind of like the father of, I call him the father of lifestyle medicine, although he's not truly. But he was doing lifestyle medicine over almost 40 years ago. And he was actually it was initially a 12-day program. He cut it down to a 10-day program because he was doing it out of St. Helena Hospital, Adventist Hospital. And he thought, we'll do it like Daniel did it for 10 days. He wasn't Adventist, but very good guy. But he would periodically have these kind of vacations where it would be a program that he would do, but in different places. He'd used to go to Costa Rica a lot and Hawaii too. But I met a guy there, and he would tell me that he was starting to get the beginnings of diabetic retinopathy, and then he learned about McDougall and went on a whole food plant-based diet, low fat. Next time he saw his eye doctor, he said, your retinopathy's gone. And he told him, well, here's what I'm doing. I'm eating like this. And his doctor said, no, it's not from that. Okay, we'll explain it. He's never seen it before, and so it is powerful and it does work. So insulin, type 2 diabetes basically is insulin resistance. There's insulin receptors that respond to the insulin to let the glucose come in. And the main cause of it is excuse me. The main cause is the storage of excess fat in tissues that are not designed to store large quantities of fat. So it's basically a dysfunction of the muscle and liver because there's not supposed to be significant fat in it. The pancreas can also be altered or have its function impaired as well. But it does respond to multimodal interventions. So what causes the high blood sugar? Well, basically, in type 1, there's diabetes, there's no insulin being produced. So you can't go in you don't get insulin, you're going to die pretty quick. So there's type 2, the insulin, like I said, the insulin receptor is resistant to the insulin. The insulin is the key. The receptor is the lock, but it won't open the lock because it's resistant to it. And then people with type 1 diabetes can also get type 2 diabetes because initially their insulin receptors are fine, but they eat a terrible diet and they wind up with resistant insulin. So they've got basically a combination of type 1 and type 2. This is just an electron micrograph of a muscle cell, and all that little starry night dots, those are little fat globules in the cells. They're not supposed to be there. And so what it does, it interrupts the signaling mechanism in the cell, as well as it increases inflammation with these cytokines. Cytokines are proteins that elicit an immune response, or rather an inflammatory response. So what happens, this is normal. You can see the insulin attaches the receptor. Then it sends a signal to the glucose transporter 4. It goes up to the cell membrane and then opens up and the glucose comes in. Well, when there's all this fat in the cell, it disrupts that communication. So it takes a lot more insulin to stimulate the uptake of glucose. So there have been a lot of dietary trials and intervention trials, rather. And so this one was, it was a 16-day interventional trial, high carbohydrate, but carbohydrates from whole foods, complex carbohydrates, not refined carbohydrates, and a high fiber diet. And what they found was in these type 2 diabetics, they didn't lose a whole lot of weight in the 16 days, but they did decrease their insulin dosing by 15 units a day. 9 of the patients were taking that were taking 15 to 20 units a day actually completely stopped, and 2 patients taking 32 units a day were able to stop as well. And that was just in a little over 2 weeks. And so it's a low fat diet, lower in saturated fats. And this resulted in more insulin sensitivity. And there's a big change in the fatty acid composition as well. And this increased the changes in insulin resistance as well as its secretion. Basically, plant-based diets have been shown to be higher in linoleic acid and improve insulin sensitivity. I'm going to talk about that a little bit later, but linoleic acid is omega-6, the ones that were in the hide stuff in seed oils that we're supposed to avoid. A little more misinformation. I mean, let me put it like this. I'm not a big fat guy. I prefer a low-fat diet as well, and don't use a lot of oils. But it's not the boogeyman that they say with research, especially in heart disease. Broad study is another one. It was a 12-week study, and they had a year follow-up. And they did have, reversal of some people, as well as all improved their A1Cs. The hemoglobin A1C it's a marker of how well your blood sugar has been controlled. It's attached to the hemoglobin in your red blood cell, and it's about a 60, 90, maybe 120-day turnover for your red cells. So it kind of gives an average of where your blood sugar's been. If it's over 6, it's high. So, and then there was a 29% reduction in their medications over 12 months. What was interesting, this was one of the first studies to show the greatest sustained weight loss without exercise involvement, just using diet alone. And here's a couple studies that showed improved insulin sensitivity. One was by Barnard with 59 patients. There was a 24% increase in insulin sensitivity in 14 weeks, and all those patients' blood sugars normalized. This other one in 2012, there was 62% normalized their blood sugar. But what was interesting is they dropped the number of medication from 4 down to 1 on the average. All of their A1Cs normalized, and their blood pressures markedly improved, down to pretty much normal, as well as their triglycerides normalized as well, their blood fats. Again, this was on a plant-based diet. A lot of people would say, well, once the beta cells are not working anymore, you're out of luck. Well, there was this lifestyle intervention with diet and exercise showed that they could actually increase beta function, and they felt it was due to alteration in the GIP secretion from the intestinal K cells. Those are cells that are in the duodenum, in the first part of the small intestine, that sense carbohydrates and fats. And what it does, it sends this hormone, GIP, glucose-dependent polypeptide. And what that does, especially with hyperglycemia, it gets more insulin secreted. And then there was another 16-week intervention, low-fat vegan diet with improved beta cell function and insulin sensitivity. And they felt it was related to the loss of visceral fat. This is the fat around your organs. That's where the big problem is. When we had COVID, the people that were the sickest had chronic diseases, diabetics and obesity. I had one guy come in, he was like 30 years old, no body fat, looked muscular, looked like he was in great shape, and he was sick with COVID, didn't have to, he had to have high flow oxygen. He had a terrible looking chest X-ray, then he got his lab back. Turned out he was diabetic, he didn't know it. Again, this was a 24-week intervention with plant-based diet and exercise, and basically the same thing. The visceral fat reduced, their blood sugars got better, and with exercise, it actually improved it even more. Also, there's altered microbiome. The microbiome is basically the colonies of bacteria in your intestines. And these are in your large intestines. There's not much bacteria in the small intestines. And we've heard about that before. That's why people like to take probiotics and prebiotics. And what they found was people with type 2 diabetics have a basic dysbiosis. They have an abnormal gut microbiome. They have a decrease in the number of cells that produce a chemical called butyrate. And it's a short-chain fatty acid. And there are other short-chain fatty acids that come in. And these short-chain fatty acids actually improve glucose control. They do a lot of things. They help heal the gut wall, the gut lining. They lower cholesterol. They improve the immune system. It's amazing. These are very important. And these cells that produce these short-chain fatty acids feed on fiber. And what food does not have fiber? Animal products. And diet and lifestyle can actually restore microbiome. And this just shows what the healthy lifestyle plant-based diet did. Again, also cut down on glycolysis in the liver. Glycolysis just break down of the glycogen, which is your stored sugar, and also you were satiated. You didn't feel hungry. Exercise. With exercise, they saw that the beta cell function didn't have to put out so much insulin because there was more glucose going to the cells. What the exercise does, it increases the transport of glucose into the glucose transporter, the 4 factor, and this was independent of insulin. That's why we tell people if they're diabetic and they decide to start an exercise program, they have to be very careful because they can significantly drop their blood sugar into dangerous levels. So exercise is great, and it works, like I said, different than insulin. This was in 2002, in I think it was. Which journal? Yeah, it was. New England Journal of Medicine. Anyways, this was a study done on pre-diabetics and lifestyle change. And what they did there was 3 groups. They were not diabetics, they did have pre-diabetes. So they put, one group was put on a placebo, one group was put on metformin, the most common medication used for type 2 diabetes and pre-diabetes, and one was lifestyle. And the lifestyle changes in this research project was not as drastic as what we're recommending. And what they found is at 4 years, you can see what percentage people became diabetic. And lifestyle did better than placebo and did better than metformin. And that was just with minimal lifestyle changes. So it actually does work. And how does it work? It attacks, addresses the root cause of the disease. And what it does is it disables the drivers of of insulin resistance, which are inflammation, oxidative stress, lipotoxicity, and dysbiosis. You know, inflammation, everybody's concerned about inflammation, and we should be. Inflammation is good. You know, you get an infection, you want some inflammatory cells to go there to fight it. But excess body fat, especially fat around your organs, promotes the release of these cytokines, which trigger the inflammatory response. And the inflammation then interferes with signaling, increasing insulin resistance. Of course, we know that inflammation also increases your risk for heart disease, stroke, a number of some autoimmune diseases. So I'm talking about diabetes right now, but it's the same lifestyle changes for all our chronic diseases. This was a systematic review, a meta-analysis of. They had 29 studies with nearly 2,700 participants, and what they did was they looked at plant-based diets resulted in marker drops of inflammation. The most common one is a CRP, C-reactive protein. That's something we easily measure in the hospital, and we have for heart people, we'll do a high sensitive CRP, and so the other two are interleukin-6, which is a inflammatory marker, and then the small intercellular adhesion molecule, another marker that's more done. That's done more for research, but all these markers dropped by the CRP dropped by 0.55, the IL-6 by 0.25, and the ICAM by 25. Basically, they said plant-based diets improve obesity-related inflammatory profiles. And these are another couple ones on inflammation. The first one was done in Brazil in 2017, in 268 patients. What they did was they looked at vegans, lacto-ovo-vegetarians, and omnivores. And the vegans had a CRP of 0.5. The vegetarians had a CRP of 0.8, a little higher. And then the omnivores had the highest CRP of 1.1. And then this other one was done here in the States in 2007, 63 participants. And what they found was the CRPs in vegans was 0.52. In omnivorous endurance athletes, a little higher, 0.75. And in people on the Western diet, it was high at 2.61. Now, oxidative stress, we want antioxidants in our body, but we do have oxidation that goes on too, and there is a role for it at certain time. But when you have too much, it stresses it. It damages protein. It damages DNA. It damages cell membranes. It promotes insulin resistance, damage to the beta cells, causes glucose tolerance, and just all the complications that you wind up getting with that. So studies have consistently shown that vegetarians, including vegans, have more favorable antioxidant status than omnivores. I was at a race one time. They have like an expo, and these guys were selling vitamins, and they had some machine that measured your oxidative stress per se, and so I did, and said, "Wow, you're pretty good." They go, "Are you taking our vitamins?" And they're selling vitamins. I said, "No, I eat a plant-based diet." They said, "Oh, okay, that's good." So, anyways, but yeah, what we found out is that we have more favorable antioxidant status in the omnivores, and basically due to that we're taking in a higher amount of antioxidants in our diet, and we have lower pro-oxidant intakes as well. And lipotoxicity, like I've already talked about a little bit, but it'll cause cell damage, death, inflammation. It disrupts the function of the mitochondria. Mitochondria are what we call the powerhouses of the cell. That's where we make all the energy in our cells. Then it causes insulin resistance, it causes elevated triglycerides and blood glucose. And how do we get it? Duh, it's, diets high in fat, especially saturated fat, diets high in refined carbohydrates, especially sugars. Vegans basically have the lowest amount of overweight and obesity of all dietary patterns, lower levels of lipids inside the muscle than the matched omnivores, as well as lowest intakes of saturated fat of all dietary patterns. And coconut oil, despite what they say, is not a healthy fat. It tastes good sometimes, if you want the oil, eat the coconuts. Again, you can have a little bit of anything without really causing much harm as long as it's not a bad habit or taking in too much. Again, the poor gut microbiome, increases gut permeability. That's the leaky gut you hear about. Increased production of the cytokines. So there's the proteins that trigger inflammation. And then you get metabolic endotoxemia. That's the bacteria, the toxins come off, and they can leak through into the system. That's why we want to have a good, healthy gut lining to prevent that. And what causes it? Basically, a bad diet. High meat, high fat, refined carbs, processed foods, ultra-processed foods, low fiber, again, alcohol and other chemical contaminants. Antibiotics can mess it up because besides killing the bacteria causing your infection, it can kill the bacteria in your gut, and then that has to regenerate. Stress and, of course, poor dental hygiene. You don't want bad bacteria in your mouth to go down. Switch gears a little bit to talk about cardiovascular disease. Now, the leading cause of death in the United States is heart disease. And that's not just heart attack. There's heart disease, there's heart valve disease, there's other cardiomyopathies, things like that. You can see heart's number 1, stroke's number 4, chronic respiratory diseases, diabetes is down there as well. Cardiovascular disease actually is listed as, when it's listed as the underlying cause of death, it accounts for over 900,000 deaths in the United States in 2022. Cardiovascular disease includes heart disease, stroke, aneurysms, dissections, peripheral artery disease. Those are all cardiovascular diseases, cardio, heart, vascular vessels. In fact, heart attack is a disease of the vessels, not a disease of the heart. And what, as far as money, it costs a lot of money to it. So about 48% of the people between 2017 and 2020, about 49% of American adults had some sort of cardiovascular disease. And we also found that 59% of non-Hispanic black females and 58.9% of non-Hispanic black males had some form of cardiovascular disease. And this race category had the highest prevalence of cardiovascular disease. And a lot of this has to do with the social determinants of health and lack of health care, lack of good food. And American College of Lifestyle Medicine is actually trying to address this and trying to address it with the leaders of our country as well. Kind of same thing. Now, coronary heart disease, which causes heart attacks, caused 371,500 deaths in 2022. Between 2005 and 2014, the estimated annual heart attack rate was about 605,000 heart attacks a year. Plus, and these are first-time heart attacks, and about 200,000 more repeat offenders or recurrent heart attacks. And the average age of the first heart attack is about 65.6 years for men and 71 or 72 for women. And again, very costly monetarily wise. And stroke, about 1 1 out of every 20 deaths in the United States is caused from stroke. And stroke caused 165,000 deaths in 2022. And in 2021, there were 7.25 million deaths attributable to stroke worldwide. Now, there are different types of strokes. There's ischemic stroke and hemorrhagic strokes. The two types of ischemic stroke. The one is where you have a bad carotid artery with a lot of plaque built up, and then just like a heart attack, it can block off, and then you get no blood flow, and whatever's getting supplied by that artery dies off. The other one is, which is maybe a little more common, is embolic stroke. The most common cause of embolic stroke is atrial fibrillation, because the atrial fibrillation, the top part of the heart is just kind of quivering like this, and blood will pool in a certain appendage there, and then if a clot breaks off, you go up to the brain. A friend of ours, a gentleman that started the CHIP program, if anybody is familiar with CHIP, died about a little over 2 years ago. He had chronic atrial fibrillation, not lifestyle related. It was a congenital thing that caused it, and he had a stroke that killed him from it. And the other, there's also the subarachnoid hemorrhage, or intracerebral hemorrhage, where a blood vessel ruptures in the brain and bleeds. That's usually caused from hypertension. Uncontrolled hypertension will cause a hemorrhagic stroke, and that's blood in the brain. And you've heard of brain aneurysms. Those aneurysms are usually outside the brain tissue, and when those rupture, it goes into the space between the brain. That's called the subarachnoid space. And those often have warning signs, and often also hypertensive related. Someone who has the worst headache of their life, when they come and they say, I got it, the worst headache of my life, the first thing we think of is a subarachnoid hemorrhage. And I've seen an awful lot of them. And often they have what's called a sentinel bleed. They might leak, the aneurysm might leak a little blood and then seal off and not leak anymore. And they come with a terrible headache, and you get a CAT scan, you really don't see anything. And so somebody comes in, and I get a CAT scan, I don't see anything, and I'm really suspicious for one, and we do a spinal tap, and then we can see blood in the spinal fluid. And so it's, if they're found, sometimes they're incidental. They'll find them and they'll watch them. They used to operate on them. Now they can do it, take a catheter, go up into that aneurysm and put these little coils in there, and it clots it off, and they're fine. And they've done a lot of good. We have a lot of good medicines, a lot of good procedures. We just don't want to have to use any of them, but if we do need them, it's nice to have. Sudden cardiac arrest is when heart just stops beating. It doesn't truly stop per se. It'll go into usually what we call a malignant rhythm. Most common is ventricular fibrillation. The whole heart's just doing this, just fibrillating, not pumping out any blood. When the underlying cause is known, we say there's about 19,000 of these a year. When sudden cardiac arrest is mentioned in the death certificate, then we say there's about 417,000 of those a year. And depending where you're at, depends on your chance of survival. According to the majority of adults, out of cardiac hospital arrests occur at home. About 18% in public settings and about 10% in nursing homes. Now, survival to discharge, if it's not witnessed and somebody comes upon you, survival to discharge from the hospital about 10%. If it's witnessed, if a cardiac arrest is witnessed, your survival rate is about 15% from the hospital. And then if it's witnessed by paramedics, it's about 18% survival. And the reason is, if I drop over here, and you say, he's just arrested, he's got no pulse, you start CPR, somebody else calls 911. If you have an automatic defibrillator at hand, you put those on, because the biggest thing is if you can shock them, you can get them out of it. And so that's why the witness arrests are better, and then even better than if we have, if you're in the back of the ambulance already and they say you go out. If I can see you go out that quickly, you got a pretty good chance of surviving. We had a patient come into, I was working one day, and we had like a 2-hour wait in the waiting room, and I periodically will look to see who's out there, make sure that the nurses are getting the right people back. And I see one patient sitting out there, like 38-year-old lady, said her chief complaint was a seizure, because her husband brought her and said, I think she had a seizure, and seizure disorder, So they let her wait. And so I'm watching, I see that they're bringing her back. Well, the ambulance comes in, so we always meet the ambulance patients, and so we get the history from the paramedics. And so I'm starting to talk to them. My nurse practitioner says, Dr. Cohen, and I turn around, she looked panicked. I go, and I knew she'd gotten seen a seizure. I go, does she have another seizure? She goes, I don't think it's a seizure. So you kind of know when they act a certain way after a seizure, they have a funny way of breathing. I go in there and she's not breathing and she's not doing anything. I said, get her on the monitor, feel no pulse, start CPR, we put on a monitor, she's in ventricular fibrillation. She's got no history. We shock her out of it. I did put a breathing tube down her. We were able to actually get it out of her before she went upstairs. And it turned out, I looked at her history. She got seen, like 5-6 days ago for bronchitis, and they put her on an antibiotic. I think they put her on Zithromax. It's an erythromycin-like antibiotic. Very common. We use it all the time. But a lot of our medications do what we call prolonged QT interval. That's the interval between when the heart pumps. You get the spike on the EKG, and then there's a refractory period where all the electrolytes go back the other way, and then you get this other what we call the T wave. Well, some people have a long QT interval, and so and that's a lot of people. It's a family. It could be congenital and a family history. One person they say, oh, I've had a couple of people my family drop over dead, no reason, and they get an EKG. You have prolonged QT. We could put medicine on it, but a lot of times they'll just put an internal defibrillator in you. And so she had been seen a few days earlier. I get an EKG, and we see she's got this really long QT interval. And she got put on an antibiotic that would make it even longer. That's why she went into it, and that can cause it. So that was hers. Remember the football player a couple of years ago, got hit in the chest and went to cardiac arrest? If you get, when you get hit in the chest, you've seen it through the precordial thump on people in the sternum. It actually causes a little electrical thing. So if somebody goes in the big fib, I still do it. I've never seen it, but it's like giving them a shock. Well, you do that at the right time. If it's in the right portion of the, if that T wave is coming up and they get that shock, they can go into ventricular fibrillation. That's what he did. That's why you hear every now and then a kid will get hit in the chest with a baseball and it goes out, and that's what that is. That's sudden cardiac arrest. So it's not always from a heart attack. Now, a heart attack can cause it too. I've seen people have a heart attack and then they go into ventricular fibrillation. Now, the American Heart Association looks at risk factors, and they look basically what they call life's essential 8. And it's basically they're tracking the progress of trying to improve cardiovascular health for Americans. And these are them: not smoking, physical activity, healthy diet, healthy body weight, good sleep, control of cholesterol, blood pressure, and blood sugar. We can do all these great monitoring, but it's getting people to make these changes that's hard. We're going to talk about a heart attack. That's a picture of a heart. This is a coronary artery schematic. The top is just really, there's no blockage there, just blood going through. The middle one, you can see that big yellow is a plaque full of cholesterol and fatty tissue and things like fat globules and all kinds of stuff. And it narrows out. Now, angina is chest pain from the heart. Now, you don't actually get chest pain or angina until you have at least a 60% blockage. And it's only when you increase your exercise, your heart rate goes up, it needs more, it's not going to get up, then you start getting the pain. Well, what a heart attack happens is usually the soft plaque, not those hard calcified plaque, it will rupture, and when the blood comes in contact with the contents of that plaque, the platelets, which are small cells that are the initial start of a clot, they start to clump and cause a clot. It's like when you cut your skin, as soon as the blood hits the air, those platelets start to so that's what causes a heart attack. You get no blood flow past that blockage, so that portion of the heart will die. And this is an EKG of a heart attack. That's the heart attack. We know by that location, we know that that's probably the right coronary artery causing it. So an EKG, each section, each lead is a different part of the heart, and so that portion of the heart's not getting any blood flow at all, and so it's exciting too. So not for the patient or the family. But one thing that we do, if it's amenable to stenting, they'll get a stent. When somebody comes in with chest pain, we get an EKG like that, we call what's called a cardiac alert. If somebody, now when the paramedics will do EKGs at the scene, they have a way now of sending it, sending the EKG copy to our hospital. Say we've got a cardiac alert coming in. When we get a cardiac alert, we notify the cardiac cath lab and the cardiologist. And they're often there before the patient, if they come by ambulance, before the patient gets there. We sometimes have a patient with a heart attack in our ER less than 5 minutes. We get them in there, draw some blood, get another EKG, cardiologist is there, cath team is there, up there, can have that stent open, that artery open in less than 20 minutes. It's a great program. So what happens is they put a catheter in where that blockage is, and there's a balloon on the end of that catheter. They blow that balloon up, they crush that plaque against the arterial wall, and then they leave that little metal stent in it. And the stents now they have a coating to prevent further clotting, called drug-eluting stent. This shows how well lifestyle medicine is. This is a very famous picture. There's a picture, the guy was about 40 years old. He was a surgeon at the Cleveland Clinic. He was having chest pain, so he goes to the cardiologist, and this is in 1996. On the left, they did a cardiac catheterization, and you can see where that bracket is. It's a distant portion of the left anterior descending artery. That's the one that supplies the main portion of the heart. They call it the widowmakers. He had such extensive disease, they told him, we can't stent you. There's too many things. We can't even bypass you. So they said, why don't you go see, called Esselstyn. Esselstyn was a surgeon, general surgeon for many years. He actually won a gold medal in the 50s rowing in the Olympics. Anyways, so he decided he goes, I've lopped off enough breasts in my lifetime. I want to do something positive now. And he went into research, and he started looking at lifestyle. And he did a research where he actually could show that he could reverse the plaque buildup in the arteries. Same thing that Ornish did, did it at a different time, but he, and they didn't know they were doing it at the same time. Well, anyways, so they said, go see Essie. And so he went to him. So he went on a very low-fat, whole food, plant-based diet, did not take any cholesterol-lowering medications, which I was surprised about. 32 months later, he was having some sort of weird chest pain. Turned out it wasn't his heart, but they cathed him, and you could see how smooth that is. He completely reversed that. That was all lifestyle change. That's pretty dramatic and pretty drastic, but it does work. This was Dr. Kim Williams. He was past president of the American Cardiology, and I like what he said. There are two kinds of cardiologists, vegans and the ones that haven't read the data, because there is so much research on healthy eating and what we consider healthy eating. I want to quick mention TMAO, trimethylamine oxide. This is a metabolite. It's caused by made by bacteria that feed on carnitine and choline, which are very high in animal products. And the bacteria in the gut will make TMA, gets in the bloodstream, it's oxidized to TMAO. And this TMAO promotes atherosclerosis, inflammation, and even clotting. And they have found that vegans, and especially vegans, but vegans and vegetarians have a low TMAO. Some actually can't even make it. They'll give them. You can give a vegan a steak high or eggs that high in choline or carnitine, and they don't have the bacteria to make it. If you can get the vegan to eat it, but they'll sometimes give them a pill. So the high fiber plant-based diet actually decreases the gut bacteria that make the TMA. And so they say that's why maybe a lot of vegetarians don't have, even if their cholesterol is a little high, they don't have heart disease. And this was a study in the Journal of American Cardiology. It just looked at plant-based diets. On the left, it's healthy plant-based diet versus an unhealthy plant-based diet, and the risk for coronary heart disease. And you can see that on the top is the unhealthy plant-based diet. The red is the healthy plant-based diet, what we're talking about. And then the one right above the red, that was kind of a combination of the two. But you can see how unhealthy the plant-based diet is. It increases the risk of coronary heart disease. And then on the right, what they're looking at, the red is the animal foods. The dashed line just above that is the less healthy plant foods, and the bottom is the healthy plant foods. And you can see that the unhealthy plant-based diet is not much better than the animal-based diet, and yet there's less risk of coronary heart disease with the healthy plant-based diet. And so our goal is to minimize the unhealthy foods and maximize the protective healthy dietary foods. This just shows where we used to eat at home versus out, back in 78 versus 18. Purple is 1978, 18 is the brown. And you can see we ate food at home was over 80% in 1978 and about 68% in 2018. And then you can see food away from home a lot more currently. And then the big one was fast food, which I wonder if I wasn't part of that study. This is from 2014, but it's not a whole lot different. 39% of our diet comes from added fats and oils, 30% from animal products, 22% from grains, and those are mostly refined grains, not whole grains, and then 9% from vegetables, fruits, and legumes. And the protective factors: fiber, phytochemicals, plant enzymes, antioxidants, anti-inflammatory compounds, all these healthy things, pre and probiotics. There's a lot of talk about, you've heard of soy and its phytoestrogens. The isoflavone, which is a phytochemical in soy, They call it a plant estrogen, a phytoestrogen, because it's similar in structure to cholesterol, or to estrogen. And it does have some mild estrogenic effects. There's not a whole lot of it in there. But it turns out, people that are, like with breast cancer that are estrogen sensitive, it turns out that the phytoestrogen in the plants are actually protective against breast cancer. The American Cancer Society and the American Institute of Cancer Research both recommend soy products for people with breast cancer. It also improves brain health because there's two basically estrogen receptors. One's alpha and one's beta. And the human estrogen will preferably go to the alpha, but it goes to both. The plant estrogen, the phytoestrogen, basically just goes to the beta cell, the beta receptor, and that's what protects. It actually blocks the estrogen from causing breast cancer differentiation. And also in bones, it preferably goes to the beta, which improves bone strength. So soy products are not unhealthy despite what people may say. So vegetarian and vegan diets, this is a study, a systematic review, meta-analysis. And basically what they found was they were basically comparing vegetarian, vegan diets versus to cancer. The controls would be everybody else. And what they found was that the majority, the vegetarian diet versus the incidence of, there was a significant protective effect of the vegetarian diet against the incidence of and/or mortality from ischemic heart disease of 25% improvement, and the incidence of total cancer 8%. The vegan actually had a significant reduced risk of total cancer of about 15%. And then on the right is the Schmelth mobile, and the left is the Health mobile. Again, everybody wants health, Schmelth rather. We do have guidelines, exercise guidelines. The physical activity guidelines of Americans. There have been two versions. The second one put more about kids and added more stuff with infants and toddlers and kids. But basically, what's recommended is 150 minutes of moderate aerobic exercise or 75 minutes a week of vigorous aerobic exercise, plus resistance training 2 or more times a week. And you want to try to get every muscle part when you do that. And what's considered, moderate, they say it's 3 METs to 6 METs or 5.9 METs. What's a MET? It's a baseball player. It's a metabolic equivalent to task. So at rest, you have 1 MET. So they compare it to just sitting at rest. And so vigorous would be more than 6. Well, how do you know if you're doing it? What I say is, when you go out to walk, if you want to be moderate, you can talk but not sing. So you're at a brisk walk. If you can't talk or sing, you're vigorous. Now, I remember being on a triathlon, and I'm running, and these 2 guys go by me, and I certainly couldn't sing or talk. These guys are running. They're blowing by me. They're young, healthy, good runners, and they're having a nice conversation. So I was probably working out better than them. So, and then here, the benefits of exercise. If you really want to know those, just look up physical activity guidelines for Americans. But what's interesting is, we know it lowers risk of all-cause mortality, lowers risk of cardiovascular disease mortality, lowers our risk for heart disease, diabetes, all these different things. But one of it that's interesting is it lowers the risk of certain cancers: bladder, breast, colon, endometrium, which is your uterus, esophagus, kidneys, lung, and stomach. But you can go on, you can Google American guidelines, physical activity guidelines for Americans, and you can get a lot more information than you need, though. And this was my old type of race before I started exercising, the 0 Mile Fun Run. Runners, on your mark, get set, go. Okay, come get your T-shirts. So that's what I would have lived for years ago. When I started working out, and part of the reason for doing races was to get me to keep doing it, because you don't want to go to a race without training for it. But sometimes I just wouldn't feel like going out for a run. I'm just tired, or just don't feel like it. The weather's not great. And to motivate myself, I would say, if I was stuck in a wheelchair, I would give anything to be able to go out and run. So, you have to find something to motivate yourself sometimes. This is a program, I was going to wear my Walk with the Doc shirt this afternoon, but I didn't. I had such good conversations and food this afternoon. So, the Walk with the Doc is a program that was started by a cardiologist in Columbus, Ohio, trying to get his patients to walk. And he'd see them in the office and say, yeah, you need to go out and start exercising, start walking more. Okay, Doc, I will. And then he'd see them next time. Well, how's the exercise going? Well, I haven't got around to it. And it was consistent. So he decided, he sent out an email to all of his patients. He said, my wife, my kids, and I are going to be at this park Saturday morning. Who would like to join us for a walk? And he had over 100 people show up. And so this is how it started. He started, more and more people would come, and so he decided to start a program called Walk with the Doc. And what it is we give a 5-10 minute health talk, and then we walk. A lot of people, try to, they do it for their practice, but try to get more people to come to their practice, get more patients. I would tell mine, I'm trying to keep you out of my practice. I'm in the ER. So, but it's a great program. When I started it in 2017, there were less than 200 chapters. Now there's over 600 chapters. There's international chapters, and there's also Walk with a Future Doc, where medical students are doing at their medical schools. And we've had people that all of a sudden their friends are we've been doing it almost every Sunday since we started. When I was on nights, I'd come in after work, and in fact, some of my night nurses were coming for a while. And then, we weather sometimes, but we weren't weathered out that many times over the years. And if we were on vacation or out of town for one reason or another, we wouldn't do it. But almost every Sunday. And so I don't believe there's a chapter here in Fort Collins. And the one in Boulder, I don't think is active right now. There's a few in Denver. The one I would recommend, unfortunately, he does them on Saturday, is by Andrew Freeman. He's a plant-based cardiologist at Jewish National, and I'm going to send a thing to the pastor and Eunice. They do, and it's on Saturday, unfortunately. I think third Saturdays they have it's an online thing. It's a Zoom thing about eating plant-based, and they have a dietitian talk about it. And it's a really good program. Unfortunately, it's on the Sabbath. So. And that's us walking. We do it a walk. Some of these guys, they'll do these Walk with the Docs, but then it won't be a good, easy walk. I've had people in wheelchairs come to my walk. I try to do it on a nice, easy way to do it, where everybody can do it. And I don't know if you can see this well, but this is a relationship. This is how they got the 150 minutes a week as the minimum. But it doesn't take a whole lot to start seeing improvement. You see on the y-axis going up, the hazard ratio of mortality. And the curve there is very steep. It doesn't take a whole lot to start seeing improvement as well. So even if you only go out and walk for 5-10 minutes, you're going to start every day, you're going to start seeing improvement. And then it starts to flatten out. Most people don't need to go see their doctor and say, can I start an exercise program? But if you have chronic disease or certain limitations, it might be a good idea to. And this just shows the percentage of adults 18 and older between 2008 and 2015. What percent are actually getting the meeting the guidelines? And for the men on the top, it's about in 2016 or 2015 it was about 25%, and women about 18%. And for adolescents, the boys on top, close to 30%, and the girls are a little over 10%. So we're not doing it. I do want to talk a little bit about fiber. We can take a quick break, but I think I'm almost done. You want to take a quick break, or just let me keep putting you to sleep? Okay. The minimum recommendation for fiber is about 25 grams a day for women and 38 grams a day for men. The average American doesn't even get half that. People say, you ask me, where do you get your protein? I said, where do you get your fiber? Because I have only seen a few people that are protein deficient. Those are usually somebody who's 80 years old, living at home by himself, hasn't eaten for weeks. So those are the people that are protein deficient. We get too much protein, but that's another topic. So there's two types of fiber: insoluble and soluble fiber. Soluble fiber dissolves in water, forms a gel-like substance, and it helps lower cholesterol. It helps improve blood sugar. Insoluble fiber doesn't dissolve. It adds bulk to the stools, better bowel movements, keeps you regular, gets the stuff out of there so that those toxins aren't sitting against your colon, causing colon cancer. They do a lot more things. Like I said, the fiber also feeds the good bacteria, make those short-chain fatty acids. There's a whole host of things that we're learning more and more. There was an article that came out probably 15 years ago or longer. It said a high-fiber diet cuts mortality. And they said it's not just mortality from cardiovascular disease, but all cause, including infectious disease, as well as some other problems. But we don't know why. And now we do know why. It's from the gut microbiome, the healthy bacteria. And they said the fiber had to come from whole foods, not from supplements. So, you can take the fiber supplement for your bowel movements, but you're going to be better off getting it from your food. And then, I don't try to worry about, am I getting this much insoluble or soluble fiber? These are the foods that they come in. You eat your variety of foods, you're going to get you're going to get both. And you're just going to get all the good things. I was addicted to my fast foods, and I don't miss it at all. It was funny. I was doing a race. It was a half marathon in Disneyland, and we start off running through Disneyland. Then you go to the California theme park. About mile 10, you run through Angel Stadium, which is pretty cool. You run around the warning track in the outfield, and you're on the big board, and then come in. But as we're running through Disneyland, it's the morning before they actually opened up. I'm running. I could smell bacon cooking, and the first whiffs go, that smells good. About the third whiff, I got nauseated from it. I haven't eaten it so long. The other thing about, just a quick story about Angel Stadium, we did a demo jump into a rock concert there. The first one was for, Blue Oyster Cult was there, and they were actually the opening act for the main band. And we did Peter Frampton, and the way we, when you open up your parachute, you wave off before you do it so that anybody above you will know you're about to open, so they'll get out of the way. Well, in the olden days, we had pilot chutes on our back with a spring in it. You pull your ripcord, it would jump up. Well, the spring on my ripcord wasn't very good, and so I often pull, and if I'm going straight down, it's kind of like a vacuum on your back, and it would just bobble there. And so I'd have to get air going over my back. So I would always open up going forward. Well, on this jump, we had smoke canisters. Well, I didn't want to be going forward because I didn't want to get caught on the smoke canister and cause a malfunction. So I wanted to make sure I was sitting up. So we break our start off. We're right over the stadium. There's 5 of us, and all of a sudden, I wave off. I'm making sure I'm sitting up. They've already opened up, and I'm just making sure I'm sitting. And I wave off, and all of a sudden I hear this weird sound. I go, well, that's weird. I didn't know what it was. Then I open up, and you look like a rag doll. I should have been 1,000 feet higher. I was about 1,200 feet, and and then I hear this crowd going again. When I did this, they thought I was waving to them, and the crowd was going wild. There's 50,000 people down there, so I heard them in free fall. And then all of a sudden, I'm looking down. I go, our landing area was right next to the freeway, and it wasn't a big landing area. And I didn't know if I could make it there, but I was over the stadium. Only one person was allowed to go into the stadium because the diamond was the only place. And 5 of us trying to make it in there wouldn't be good. So I look, I land in the parking lot, and I'm going to hit a couple cars. So I make it over to the stadium or over to the landing area and land. And there was a small section of the crowd that could see me land, and they go crazy again. So wasn't a smart thing to do, though. Anyways, that's that. So how much fiber we should be taking? Men, 38 grams. You see, over 50, you can cut it down to 30. That really is the minimum. Women, 25, and then a little less when you're older. The maximum health benefits seem to be achieved when we're getting at least 20 grams per 1,000 calories. So if you're on a 2,000 calorie diet, you should be getting 40 grams of fiber a day. We talk about the paleo people and the hunters and gatherers. Well, when they look at the stool samples from people that lived in, a couple thousand years ago, they were getting 70 to 150 grams of fiber a day. So they were either the animals they were eating were all fiber, or they were eating more gathered food than hunted food. And this just shows, what's interesting is I didn't know this until a few years ago, that avocado is pretty high in fiber. And it's got good monounsaturated fats as well. You want to try to get 12 to 15 grams of fiber a meal. Not that terribly hard. For my average breakfast, I have steel-cut oats, probably a half a cup or more of mixed berries. I have blueberries, raspberries, and blackberries on it. I'll put maybe a tablespoon of flaxseed or chia seed or both. And that stays with me for a good 45 minutes. And then I'll have a piece of either whole grain toast or sourdough toast. And these foods have, refined foods have very little fiber in it, and animal products and oils, there's no fiber in it. Heart attack with extra cheese, heart attack with bacon, double bypass, no pickles. Hey, where's my diabetes and large stroke? So true. Yes, it's true. The low-carb, high-fat diets. Okay, a true low-carb diet is going to be 5 to 25% carbohydrate, fat 65 to 75%, and then 10 to 25% protein. And this is a typical recipe for a cheesy taco casserole. You're getting 50 grams of fat, 27 grams of that is saturated fat, 232 milligrams of cholesterol, and very, very little fiber. This was a systematic review in 2018 of 33 randomized control studies and 3 controlled clinical studies. And they compared a low carbohydrate, less than 40% energy, with a low fat, less than 30% energy. And I'll talk about where they get that 30% from in a second. The hemoglobin A1C declined more in the low carb diet than the low fat. Well, when you're not taking any carbs, it's hard to have your blood sugar elevated. In the short term, that was 1.38%. A year, 0.36%. 2 years, their A1C was the same. What they said was low to moderate certainty that dietary carbohydrate reduction of less than 40% yields slightly better metabolic control of uncertain clinical importance than reduction in fat to less than 30%. Years ago, forget what is the American Academy of Sciences and National Health, and a group of them got together. This is like in the 80s, because of the people getting obese. We're seeing more heart disease. We're seeing more type 2 diabetes. So they said, we need to get this under control. What should we recommend? We're eating too much fat. At the time, we're getting 42 to 44% of our calories from fat. Well, they looked at Japan. Practically no heart disease, no type 2 diabetes, and no obesity. And they're getting 13% of the calories come from fat. And they say, well, we can't ask them to do that. So they split the difference at 30%. That's where that comes from. So when you look at a research article and they talk about a low-fat diet, they'll often use 30%. In fact, there was a study, part of the Nurses' Health Study, which is hundreds of thousands of nurses. All kinds of studies have been coming out of this. And this is, I think, in 2006. They did a study, does a low-fat diet or will a low-fat diet lower the risk of heart disease and recurrence of breast cancer in women? And at the end, they said the results were, no, it doesn't, didn't do it. And then in the limitations in the study, the author said, well, we want our low fat to be less than 20% of their calories come from fat. There was 29%. We wanted the, and so the low fat was getting 29%, the high fat was getting 36%. So not a whole lot of difference. And so it was criticized for that because they really didn't have a low fat group. And so in these studies, this is another one, a low-carb diet versus usual care, 18 studies. Low-carb reduced medications 1 year. Low-carb diet did reduce our medication. 1 year, their A1C was reduced by 0.28%. Good cholesterol, the HDL went up a little bit, 0.06. Triglycerides went down a little bit. But there's no improvement in weight, total cholesterol, or LDL. What they said, some favorable results with low-carb diet, less than 50 grams per day, is unachievable. 50 grams a day is like 10% of your calories come from carb. That'd be about 200. That'd be 200 calories, 4 calories per gram. They said a low carb of 130 grams a day is more achievable. The short-term risk, increased LDL, your bad cholesterol, poor glucose tolerance, worsened kidney function, bone loss, all kinds of stuff. The worst is probably the bad breath. Again, 9 more studies, low carb versus normal or high carb. Low carb seemed to do a little bit better, but it didn't decrease the LDL cholesterol. But the risk long-term, there's increased all-cause mortality in the low-carb group, increased exposure to POPs, those are permanent organic pollutants that induce metabolic disorders, and increased birth defects, impaired artery function, increased risk of cardiovascular disease. So basically, what the problem with it is, low-carb diets they're high in fat, high in protein, they're animal-based, high in cholesterol, high in other pathogenic factors associated with disease risk, and they're low in fiber, phytonutrients, antioxidants, anti-inflammatories. It's not a good diet. There was an article, I don't have it up there, but it's called The Effect of a Plant-Based, or maybe I do. Well, this one was associated with an animal of plant protein intake with all-cause and cause-specific mortality. They wanted to examine the associations of animal and plant protein intake with the risk of mortality. And what they found was that the high animal protein intake was positively associated with cardiovascular mortality, and the high plant protein intake was inversely associated with it. And this is with people with at least one more lifestyle risk factor. And the problem with the animal protein, it's high in certain amino acids that are sulfur-containing. That they did studies years ago. They showed these ones that plant proteins are low in, we don't need much of it. And so that's probably why. You also heard that plant proteins are incomplete proteins. Every plant, with the exception maybe fruits, every plant protein has all 9 essential amino acids. These are the amino acids that our bodies cannot manufacture. They have to be taken. And you're eating a variety of foods, you're going to get plenty of protein and enough of all the amino acids. So this is the one, yeah. Effect of a plant-based, low-fat diet versus an animal-based ketogenic diet on ad libitum energy intake. Basically, they put them in a metabolic ward for 2 weeks. Half the guys were on a keto diet with 70% of calories coming from fat, 10% from carbs. And then after 2 weeks, they switched. And they did all kinds of testing on them. One thing that they found was there's a what insulin glucose conundrum, basically. They say people that eat too many carbs, they have high insulin, it drives fat into the cells, and they wind up eating more, and they get fatter. Well, it turned out on these, the people that, and they can eat as much as they want on these diets, and while they're in the ward, it turned out that they ate less, the low fat, high carb actually ate less than the other ones. They lost a little bit more weight, but what was interesting, the weight loss in the keto diet was lean muscle mass weight loss, because your body still needs glucose, and so it metabolized their own muscles to make glucose for them. So the other, so it basically it's not a healthy diet. You've heard of the carnivore diet as well. People eat nothing but meat. I was just seeing a couple of staunch carnivore physicians preaching it to the choir. Say, well, I'm going to cut back on my meat because my calcium score on my CAT scan shows that I'm starting to build up calcium and plaque in my arteries. So, and there was also another study just recently done. I don't know all the specifics of it, but they looked at these people. They called them lean mass hyper cholesterol. And what they did was they took these people. They had a hard time finding enough of them. They had 100 people. They had completely normal triglycerides, blood fats, but they had very high cholesterol. And so they didn't have a control group really to look at. And so they did the study, and they took half the people, they let them eat their normal stuff, and then they put the other ones on a high keto diet. And their bad cholesterol, LDL was, I think in the bad one, it was like close to 200. These guys went up to 300 on their bad LDL. And the researchers said it didn't increase their plaque. They did it for a year. Well, people looked at the study and said, wait a second, you're not giving us all the information. And they had to give them all the information. It turned out that they increased their plaque volume over a year 4 times. It quadrupled. And it was a lot more than any other diet, any other simple diet. So they said, well, we didn't get it all. It was supposed to come out as a preliminary. We're sorry it got, they tried to hem and haw. They just tried to. But if you get online and you get some of these grifters, they'll tell you, this diet, LDL cholesterol doesn't hurt you, which we know. Let me tell you a little bit about the CHIP program that we did a few years ago. It was initially called the Coronary Health Improvement Project, and We started doing it in the early 2000s. We did we did twice a year because it was quite a bit of work. And we do blood work before and after. But what I noticed after the first couple ones, it's not just for coronary health. People with diabetes, their diabetes got better, their high blood pressure got better, they lost weight, autoimmune diseases improved, arthritis went away. I said, this is named wrong. They did change it to the Complete Health Improvement Program. And now it's called PIVIO. It's coming out of Australia, and I'm just not sure. I've heard people that have done CHIP for a long time and say they don't like it. And there's a group of cardiologists actually in Southern California are trying to start another CHIP-like program, which would be great. This was started by Hans Deal. I don't know if any familiar with Dr. Deal? Yeah. Actually, his daughter lives here in Fort Collins, and she's married to a physician. Good Christian people. Unfortunately, they're not coming to church here. But in fact, Hans tried. They were living in Colorado Springs. He was in the Air Force at the time, and can you just befriend him and maybe get him to come to church? I go, he's going to church, But great guy. He's a good guy. I'm going to try to get him to start a Walk with the Doc program here. He was research and education director at the Pritikin Longevity Center. And what he was concerned about is most people couldn't afford to go there. They'd had great results there. So he started the CHIP program as a community-based program. Now, it was like $200 to do the program. I thought initially that was a lot to ask people, but they get 2 blood draws, they get meals every night for 4 weeks, which my wife and I did. And it actually cost us money because we didn't get enough money from them to actually cover everything. But a fantastic program. And so, unfortunately, we lost him a little over 2 years ago. This is a group, one of our groups. And a couple of cases. This guy was a 72-year-old male with claudication. That's pain in your leg because you got narrowing of the artery, and when you start walking too much, you get pain because he's not getting enough nutrients. He could only walk about 100 feet without stopping. At the end of the 4 weeks, he was walking 3 miles a day pain-free. Yes, exactly. This is a 48 lady with arthritis and reflux disease. She was taking 3 Motrin a day and 3 to 4 Vicodin a week, and she was taking Nexium for her reflux. 2 weeks in the program, she said, I don't have to take my pain medicine anymore, and my reflux stopped. Great. This lady, 43 years old, diagnosed in 2005 with multiple sclerosis. And her doctor said her prognosis, looking at her MRI, she'd be in a wheelchair in 5 to 10 years. He wanted her to get on medicine right then and there. And she's actually an Adventist. She went to our church. And she did a very smart lady. She researched, found out about Dr. Swank. He was doing, I'm not sure what years he was doing this, many years ago, looking at diet and MS. So she came to our program, and we put them on a jump start for the first few days. And she says, my wife has, how's it going? Well, we're already eating healthy. Why are you here? Well, she learned a lot. Well, she went to a very low-fat, whole food, plant-based diet. That was 20 years ago. And her MS is not advanced. She goes to our Walk with the Docs. And her neurologist is amazed and baffled. This is a pretty drastic case. 47-year-old male. He had type 2 diabetes. He weighed 192 pounds. His triglycerides were over 3,000. His blood fasting glucose was 240. Now, the triglycerides, we want them under 150. Over 500 we consider critical. And his total cholesterol was 440. And he was on 2 medications, metformin and glipizide for his diabetes. Well, I get a call from the lab saying, we got some critical values for you. So I tell this guy, I go, listen, especially those triglycerides are really concerning to me. You can have a lot of problems. You can get pancreatitis, all kinds of things. And he was kind of slow and plethoric. He said, I'd really like to try this first. Well, you know the risks. And I'm not their doctor. I don't write prescriptions for them. And so about 3 days into it, he says, I'm thinking more clearly. And we do show a slide of a video of a hamster pouch under a microscope of the capillaries with the blood flow going through it, the red cells going through it. And the capillary, the diameter is only big for one cell at a time, so they have to go in a row. And they're flowing nicely. Then give it a fatty meal. And then it shows all the red cells are stuck together from the fat and just sludging. And I'm thinking, he's getting blood flow to his brain now. And if I was to draw his blood when he came in, it'd be red on the bottom and it'd be kind of translucent on the top. His would be pure white on the top. It's just fat. So that was unfortunate. 30 days later, he dropped 20 pounds. His triglycerides, it should be 3,000. It went from over 3,000 to 125. His glucose went to 130, fasting, and his total cholesterol dropped 300 points to 140. That was in 4 weeks. And he stopped his medication. So his glucose was 130 on no medicine, 240 on 2. Very impressive case. So, and I've never eaten there, but I've seen it. Oh, I stopped to, should have showed you all this stuff, huh? There we go. Stop smoking, quit drinking, eat less, exercise more. Are you some kind of health nut? This is just another case study. I'm not going to go through it. A gentleman with 36 years old, he had cancer, got treated for cancer, but he changed his lifestyle. He went from being a food and wine connoisseur to a whole food, plant-based diet devotee. And his entire family followed him. Well, Carlos had type 2 diabetes, had a heart attack, had high blood pressure, high cholesterol, peripheral artery disease, recurrent gout, and cataracts that they said are going to get worse. They gave him a 2-year survival. He was on 17 pills a day, 35 to 40 units a day. A year later, he followed that too, and no pills, no insulin, and all those, everything just improved dramatically. He had a nuclear medicine scan of the heart, showed now went from ejection fraction of 50% to 61%, which is normal. No evidence of ischemia or poor blood flow to the heart. It's amazing. So this is what's possible. Not everyone's willing to make the necessary lifestyle changes, but everyone has a right to know that lifestyle changes are safe and highly effective treatment option. You still may need medications. There's no doubt about that, but you can still optimize everything. And the greater the change, the more impressive the results. I always recommend, start slow and continue to gradually continue. It wasn't hard for me. I changed from a fast food diet to a Mediterranean diet. I was still eating meat, but the transition was real easy after my chest got cut open to go to a much healthier diet. So basically, eat whole plant foods, 9 or more servings a day of fruits and vegetables, 6 more servings a day of non-starchy vegetables, 3 more servings a day of fruit. And sugar and fruit is not bad, not going to bump you up. So eat a rainbow of fruits and vegetables. Eat a lot, a large salad a day would be great, with large, dark, leafy green vegetables. Berries are so helpful. The color of the berries is from the phytonutrients in it, and so they're very high in fiber. They're very high in antioxidant. In fact, raspberries I think are the ones highest in fiber, and relatively low in sugar as well. And then 2 servings of legumes or legume alternatives. Less processed. Tofu is is considered minimally processed, and it's fine, it's safe, it's healthy, as well as tempeh. I like tofu. Years ago, when June was at work and I was home, and I was going to make some sort of chicken dish, some breaded chicken, seasoned chicken of some sort. And I go, well, I'll put the seasoning on the tofu, and so for her. So I made the chicken for me and the kids, and the tofu for her. And then I tasted it. I'm thinking, it tastes pretty good, but I wouldn't let her know that I liked it. So, anyway. And then, 3 or more whole grains and starchy vegetables. All this has to do with just how it's helped diabetes, but again, it helps heart disease, autoimmune disease, hypertension. People with hypertension, when we do our program, by the third day, every program would seem like someone say, I can't eat like that. I go, why not? Because I feel like every time I'm going to stand up, I'm going to pass out. So I take their blood pressure. Well, it's sitting here, it's like 105 over 65, and you're on 3 medicines. Stand up, you're going to pass out. So, but what the difference is, I think part of it is low fat because you don't have that sludge, so you're opening up more blood vessels for increasing your volume to put the blood in. But also, they're not eating packaged processed foods or restaurant foods. 90% of the sodium that you get is from those foods. What you add, if you add a little bit of salt to your food that's not, you're going to taste the salt, and you're not going to get that big salt purge. So some people say use potassium salt, but they doesn't taste quite as good. Potatoes and diabetes risk, not really. 5 studies report either no or negative association. 2 studies showed a positive association with diabetes, and 3 of 3 studies showed a positive association with French fries. And I don't think it's so much the potato, it's everything, all the butter and sour cream and all the other stuff you put on it. There's a 2018 study showed a significant risk in consumers of total who consume boiled potatoes. My wife and I decided to do this potato diet one year. It was a diet experiment done years ago on these 2 very healthy, fit people. For 6 months, nothing but potatoes. They had to actually add oil for them because they weren't getting enough calories, because a potato is only 80 calories, and these people were burning 3,000 calories a day. And so we went on a potato diet, just to try it out for a couple weeks. Nothing but, we baked them, roasted them. I did make mashed potatoes once. That was close-up adultery. I added a little soy milk or almond milk to it, but that was it. And I never felt like I needed anything else. We were exercising still, and I lost 3 pounds in 2 weeks. So they're not fattening if you eat them right. But I don't recommend people going on a potato diet either. I actually was eating some greens along with it just because I just didn't feel like, I feel like I needed those too. Colorful starchy vegetables, again, the phytochemicals in the plants give those colors. And nuts and seeds, nuts are good. I don't overdo it. It's easy to sit down and eat 1,000 calories or 2,000 calories of nuts. When I was a kid, we had a nutcracker nuts. After you crack a few, you're tired of it. Now you got a bag. You can just eat them, and you can fill yourself up pretty quick. People that got 4 more servings of nuts a week had a 36% reduction of diabetes risk when compared to those getting less than 1 a week. And then same with chia seeds. They're very healthy. Chia seeds and flax seeds are very high in omega-3 fats. People say we want that omega-6 to omega-3 ratio not more than 4 to 1. Because omega-6, these are essential fats. We have to take them in our diet. Fish don't make omega-6. They eat the algae, okay? So if you want to get, and that is that's the DHA and EPA, the long-chain omega-6s. The alpha-linoleic acid, which is omega-3 in the seeds, and linoleic acid, which is omega-6 in the seeds, are short-chain. Our body will elongate. The research has shown, in mice, you can get increased inflammation. There's no research in human data research shows that these high seed oils cause increased inflammation. In fact, the research has shown that when you replace saturated fat with any kind of oil, including seed oils, your cardiometabolic markers come down, as well as your risk for heart disease comes down. Again, I'm not a big fat guy, or lover of fat, and I like to be on the lower end. But what happens is, and the other thing they say, well, omega-6 make arachidonic acid. That's one of the byproducts as it gets elongated. Well, the arachidonic acid, 0.2% becomes arachidonic acid. And arachidonic acid is associated with inflammation in the inflammatory process, but also in the anti-inflammatory process. Again, there's no research showing that. In fact, I just saw Dr. Walter Willett, probably the world-leading expert in nutrition out of Harvard, say, just condemning all those people that are ragging on omega-6. To make America healthy again is going to actually make people less healthy. Because once they take the food dyes out, people think, oh, these processed foods are now healthy. Once they replace and start using lard to cook our French fries and fry our foods in, whoa, now it's healthy again. They're going from the wrong side of the aisle. So that's it for that. Basically, with nuts, keep them moderate. Again, you don't want to eat 2,000 calories of nuts in a day. Again, we want to minimize refined carbohydrates. Again, what the naysayers say, don't eat carbs. They think all carbs are bad, even carbs from whole food. Well, foods associated with the most disease reduction derive most of their calories from carbohydrates, with the exception of nuts and seeds. In fact, that guy that I told who lost 20 pounds, dropped his cholesterol, his triglycerides, he was getting probably 60 to 70% of his calories from carbohydrates, but from whole foods. So what are refined grains? It basically removes the bran and the germ, and then that you lose 80 to 90% of the fiber, 70 to 80% of the vitamins and minerals, and 95% of the phytochemicals. That's why refined carbs are unhealthy. So what's a risky lifestyle? Going to war, going to a fire, getting in a car accident, driving drunk, going to Haiti for a medical mission trip. Our daughter did that when Haiti had their earthquake. That might be considered risky, jumping off a cliff or a bridge. That's not me, that's my son. I don't believe in base jumping. It's all relative. To me, this is safe. But what you notice, what's really dangerous there, my shoelaces are untied. Not going to cause a problem. That could be bad too. So like I said, we don't have to be perfect. We can enjoy, a healthy, even an unhealthy snack every now and then. We don't want to do that. But going to the theater could be dangerous. Could be risky. That's Ford's Theater and Abraham Lincoln. So my goal is to die young at an old age. So far, I've made it to the old age. So anyways, thank you so much for coming and listening to me. And there's just, we need sometimes just to get help. We can get help from God. We can help each other in a journey like this. You can start a life group of, plant-based eating or healthier eating. It looks like, I've seen you guys are doing a lot of really good things here with the herbs and, and all those, the cooking classes, and it's the right thing to do. And it's amazing. Once you change your taste buds, it takes about 30 days to change your taste buds. I just remember after I changed everything, went to a restaurant, got some soup. It was a vegan soup, but before I wouldn't have even noticed, but it tasted like it had way too much salt in it, and I could feel the oil in it. And your taste buds actually change, and your pleasure center resets itself at a lower area. And so it doesn't take as much. And I haven't had a soda for 20 years. We had some root beer and took a little sip of it. I don't see how anybody can drink that stuff. And I lived on it. So, anyways, any questions or concerns? Or if not, I think we're done. You're welcome. Yeah. Yeah. Yeah, it really is. It's carb has become a 4-letter word, and it's the refined carbs that are bad. When you're getting your food from Whole Foods, you're getting not just carbohydrates, and the carbohydrates are long chain, not these little glucose molecules, and they're slowly released into the bloodstream. But you're getting all the other healthy stuff with it. Even the keto diet. There's been studies with plant-based keto, not as bad as the animal-based keto, and there is a place for a true keto diet where you're getting. It's for kids that have intractable seizures. It turns out that does it. There is some research as well on certain cancers because the cancers feed on glucose. That you cut it down, but that's something they're still doing in research, and be best to talk to an oncologist about that kind of a diet but you can still do a low carb plant-based diet. Very hard to do it actually, it's for the majority people. And if you look at it, people, the longest living and the healthiest people around the world eat mostly plants. You look at the 5 blue zones, even including Loma Linda. Are they completely vegetarian or vegan? No, but they eat very little meat and not on a daily basis. Yeah. Yeah. There are, you can Google like Neil Barnard. He's actually done quite a bit with it. Furman, you could check with him too. Then Dr. Yeah, you mean Esselstyn? Yeah. Oh, what's his name? T. Colin Campbell. Yeah. He does quite a bit of stuff with it too. And then the drmcdougall.com, the McDougall program that I talked about earlier today. They're all like that, and they all have great results with a plant-based diet and diabetes. So there's. When you cut out the carbs, your blood sugar is going to go down. But like in that one study, the keto study, when the 2-week where they 2 weeks on 70% of fat or carbs and 10% fat or carbs on the other. The other thing that they did in that study was a glucose tolerance test, and at the end of the 2 weeks, the ones on the high fat keto diet, they flunked the glucose tolerance test. They had a high glucose at 2 hours. The ones on the high carb didn't. They had a normal glucose. So, and it goes to, they were just putting more fat into those. They're making their insulin somewhat resistant. And these were people that were not diabetics. I mean, I had a high fat diet for a long time. And, I think eventually I would have become a diabetic if I would have kept that up, if I would have lived long enough. And some people, it's like that one with the old guy. He stopped all his medicine, and he was a diabetic since '93. So he has obviously still had beta cells left, but you have to do the best you can. You try it. And I'd look, and it's the low-fat portion, really try to minimum all fats, even oils. When I first started doing this, I was on a very low-fat 10%. Now I do have some fat in my diet. I'll eat avocados now and then. I do have chia seeds or flax seeds, and I don't cook with oil for the most part because she does all the cooking. No. But no, we use very little oil. I wouldn't say no oil, but it's not a big part of our diet. It's probably less. Well, I'm still getting probably less than 15 to 20% of calories from fat. So. Anyways, thanks. I just want to say this. I'm really impressed with this church, and I wish you guys were closer than 2 hours away. Yeah, well, time of day we came yesterday. We came up yesterday, and it wasn't too bad.
Oh, okay. Must have not hit the 5 o'clock traffic. If we could get your wife up here too, we just wanted to thank you both for coming out here, taking the time to drive all the way out here and put this little presentation on for us. You're never too young to change or too old, right?
Exactly. And Eunice is the one that got me here. So.
Yeah, blame her.
Yeah. Blame Eunice.
Blame her.
So Eunice did get this plant for your wife here. And then as a church, we do have a thank you gift headed your guys' way.
That will go through the mail.
That
You
will
will
be in the-
receive it later.
Okay, all right.
So we
Thank you so
appreciate you all
much.
taking
Thank
the
you so
time.
much, Bill.
And then if we could just say a quick prayer with you all, and then,
Please do.
and then we'll close.
Thank you all for coming.
Oh, yeah, and thank you all for coming
Definitely, yes.
to support and hear a little bit more about, healthy ministry and what the church, one of the foundational messages of the church is. So that's great.
Right on.
Dear Lord, thank you for this day. Thank you for gathering us here to hear a little bit of Dr. Conan and his life, Lord, and the stories he has for us that can help us be healthy, live longer, and die young at an old age. So we appreciate all that he's done for us today and for all that he has been taught so that he can teach us, Lord. Thank you for the amazing bodies you have given us with the opportunity to take care of them and build this temple for you, Lord. So thank you for all you've done for us. Bless us today and bless them as they head home, and bless each and every one of us as we head home today too. In Jesus' name, amen.